I'm Dr. Anthony Cave, and tragic news today about Toby Keith. I wanted to make sure that we talk about what you can do to reduce your risks of developing gastric cancer. That's what it looks like there. Fortunately, there are many things we can do to reduce our risks, and you can advocate for yourself and your loved ones. So I want you to take away the key tips here that can help you identify the signs and symptoms, reduce the risks, and recognize just how important mental health is for gastric cancer, maybe more so than other cancers. And then we'll have live Q&A at the end. So first off is we got to acknowledge, and we'll talk about this at the end, the maladaptive denial of illness that unfortunately plagues so many of those, not only with gastric cancer, but also ovarian cancer. That's a big part of the mental health component of cancer that no one talks about, that you need to know about. We will talk about that at the end. Gastric cancer, first off, like you see here, this is a specimen from someone's stomach. They've had a gastrectomy, so they've removed the stomach, and you can actually see the hole that has been caused and all the inflammation through that cancer. 1.5% of the population, 1.5% of all cancers diagnosed in the United States are due to gastric cancer. And there are two B's you have to know about the symptoms or the signs that present themselves. The first is the bleeding and then the bloating. These two B's explain almost all the signs that someone will have. The bleeding will lead to anemia because when you have an ulceration in the stomach, as the cancer eats through the mucosal lining, you'll bleed, you'll lose blood, you'll become more fatigued easily, feel tired, exhausted. You may have blood in the stools. Then there's the bloating. When you have this mucosa that's not properly secreting digested juices, or you have blood that's coming out into the stomach that can be irritating, can lead to indigestion, acid reflux, having a poor appetite. And the bloating symptoms come from that cause. So the two B's are the main signs that you'll find, but unfortunately, they're so incredibly non-specific, which is why you need to be on the lookout if you have the risk factors that we'll talk about, that these signs and symptoms should not be ignored, even though they can happen in so many of us. If you have those risk factors, you got to be on the lookout for something going on that's not a normal cause of fatigue or bloating. Now, the risk factors almost all center around inflammation. This is so important to know because this explains why all these different risk factors can cause cancer and how you can reduce the risks. Now, unfortunately, being a man, I don't know if that's inflammatory or not, but that is a risk factor. It's actually a non-significant increase in risk. So are pretty much anyone who's not white. We don't know why, but these ethnicities do have a higher risk. It's probably an interplay of maybe some genetic predisposition, but also lots of environmental factors that we'll talk about in just a moment. First one being H. pylori, which I have a cute picture of this guy here. This is an electron micrograph of that bacteria, H. pylori. It exists in the stomachs of about 30 to 40% of the population. But only a very small fraction of those with H. pylori will ever develop gastric cancer. What does this have to do with the inflammation that I mentioned? It has to do with inflammation because this H. pylori will eventually cause small inflammatory responses in the mucosal cells of your stomach, leading to all sorts of nasty lesions like what you see here, a bleeding ulcer. H. pylori is probably the most preventable, if not the most common cause of ulcers in human beings. And sure enough, if you treat the H. pylori, it's a pretty intense round of antibiotics, but if you treat it, you can treat the cause of ulcers. Unfortunately, those ulcers, which can arise from the inflammation that's constantly caused by H. pylori, can turn into worse ulcers like you see there. That actually has a lymphoma on top of it. But that inflammation, as the cells keep trying to repair the inflammation, allows for DNA to be damaged as you're constantly making new cells. And every time you make new cells, you risk DNA damage that can cause cancer, which is why any inflammation from H. pylori or the other things we're going to talk about causes more cells to divide. More cells that divide give you more opportunities to produce a cancerous cell. Now, nitroso compounds can also cause this inflammatory response in your stomach? What are nitroso compounds? Well, the main ones are going to be from meats, especially cured meats, highly salted or processed meats. So those can increase your risk of gastric cancer by 15% for every 30 grams. It's half a serving consumed per day. So think of like hot dogs, hams, cured meats, etc. There's also some nitroso compounds in tobacco. So when we smoke cigarettes, which is also a major risk factor. Alcohol is an interesting one because some studies show that maybe there's a protective element of wine, but in general, as you know, for the vast majority of cancers where alcohol can be involved, it's going to be deleterious, especially liver cancers, breast cancer, etc. What about obesity and inflammation? I'm not too sure if you know this, but obese individuals tend to have a higher degree of what we call chronic baseline inflammation because the body is always in this inflamed state from the excess adipose tissue. And actually, the risk factors are not insignificant. It's in the order of 20 to 80% increased risk when you're above a healthy BMI. Next is EBV, or Epstein-Barr virus infection. This is also another inflammatory state as this viral infection continues in your body unchecked. Then there's stomach surgery and histories of abdominal radiation, especially in individuals who've had Hodgkin's disease before and they've been radiated in the abdomen. What happens here? For stomach surgery, clearly you're cutting open the stomach, and as the stomach is healing, there's going to be some inflammatory response. And same with radiation, especially if you've had a history of lymphoma in that area. You not only have had a history of inflammation throughout your body, but specifically you have irradiated and damaged cells in your abdomen, including those in the stomach. And as your body tries to repair that damage, it has that risk of causing mutated cancerous cells. We're going to talk about genes in here as well, but I just want to take a quick moment to give a shout out to so everyone is offering such positive comments here. Heidi, good to see you. And hi, Jesse. And Juliana, where can you get a test to see what your inflammatory levels are? So the big tests are going to be the erythrocyte sedimentation rate, literally how long it takes your red blood cells to sediment. And you drop them at the top of a test tube and you see how long it takes them to form a sediment at the bottom. It's like with a timer, you're watching it. And then the reactive protein. Those are the two common inflammatory markers that we can test. But there's other things that we're going to talk about testing in just a moment. We'll get back to the genetic causes of gastric cancer in a moment. Do you believe people are making the wrong lifestyle choices, Julian? I believe society is absolutely pushing people to make poor lifestyle choices, not necessarily blaming the individuals, but the society that makes all these risk factors so prevalent and disempowering to our patients, which is why you need to know what the signs and symptoms are so you can be on the lookout so that you can also reduce your risks. If you have multiple of these risk factors, you're a man, you're not white, you're obese, you smoke cigarettes, you consume lots of cured or processed meats. I mean, if you're falling into this category, you need to be extra on edge because even though gastric cancer only is responsible for 1.5% of all diagnosed cancers, there's virtually no cure for it. You know, Toby Keith himself, he had 2 years where he survived with surgery, radiation, and chemotherapy, but none of this is, well, rarely is it curative, let's say. Depends on how early it's caught. But if you're appreciating everything we're talking about, please hit that like button. Subscribe to keep up with all my live streams and other videos. Our live Q&As will answer more of your questions at the end. And remember that if you click the link below, you can join our Medical Secrets exclusive access to join our private live streams where I can answer more of your questions on an individualized basis. We'll be meeting next this Sunday, actually. So be on the lookout for that link if you're part of that group. And let's get back to the other causes of gastric cancer, genetics. The CDH1 gene mutation is one that certainly can predispose individuals to gastric cancer. Lynch syndrome is one of many genetic syndromes where gastric cancer is at a higher rate. There's several other genetic mutations out there. Interestingly, having an A blood type appears to be correlated. We don't know if it's causative or just associative, but it's really curious. So many things you can modify in your lifestyle, but some things that you can't change. So what can you change ultimately is you can tip the balance of inflammation, stuff that causes what you see here, what you see here, ultimately what leads to this gastric cancer, you want to try to tip that into the direction of antioxidation, anti-inflammation, ultimately normal tissue healing. So what is here, and what does this have to do with mental health? Well, these images here are from an esophagogastroduodenoscopy. Good luck pronouncing that. For short, we call it EGD. It's that camera that goes in your esophagus, looks in your stomach, gastric, so esophagogastric duodenoscopy. Your duodenum is the first part of the intestines. So I provide anesthesia for these, and I gotta say, having propofol anesthesia makes these EGDs so much more tolerable for patients. So grateful that we have these fantastic tools in modern medicine. But these cameras allow us to identify parts of your gastric mucosa, meaning the mucosal surface in your stomach, to identify spots that look like they might be precancerous or maybe cancerous. The earlier we can identify these, the sooner we can act on them, whether through surgery, radiation, chemotherapy, etc. More importantly, we can find gastric ulcers and be on the lookout for H. pylori to treat that to prevent those ulcers from ever turning into cancer. What you see in the bottom right-hand corner with the blue and red is actually a particular dye with acetate, and indigo carmine. These are just names of dyes that actually allow us to better visualize the edges of gastric cancer, or at least some types of gastric cancer. The better we can identify them, the better we can sample them, and then eventually remove them. So mental health, though, well, this is so key. And nobody ever talks about this. So please, if you have ever felt stuck, if you have ever felt in survival mode, you probably know that I define survival mode as not being in control and having threats around you. If you have felt in survival mode, you've probably felt like you're in what I call the psychological fetal position. We get very rigid. Fears, uncertainties, and doubts eroded our confidence and eroded our ability to think outside the box. They erode our willingness to advocate for ourselves, to go outside of our comfort zone. When individuals in these psychologically, we're in this survival mode, protective mode, we don't want to address things that are uncertain. We don't have a tolerance of ambiguity or a tolerance of uncertainty. When such individuals have the signs and symptoms I mentioned at the beginning, fatigue, bloating, poor appetite, easy satiety, feeling tired, maybe even blood in their stools, you tell me, if you're already in survival mode and like I said, you don't tolerate ambiguity or uncertainties, you stick to your comfort zone, you don't want to go outside of your fetal position, are you going to go out to your doctor and try to advocate for things like H. pylori screening, for that esophagogastroduodenoscopy, that EGD? Are you going to talk about genetic screening is appropriate for you? When we're in that stuck mode, we are less likely to seek care, especially for these ambiguous symptoms. Ovarian cancer is another really, really prominent one. Pancreatic cancer, another one. We don't have good treatments for most of these cancers, and their signs and symptoms are so ambiguous and so non-specific that when we're already feeling down, either depressed, once again, labels. I don't care about labels as much as the root cause. What does depression lead people to? To being stuck. Anxiety, being stuck. PTSD, being stuck. When we're so stuck and we're not as likely to want to reach out for help when these non-specific symptoms come up, we miss valuable time to seek treatment early on, when perhaps surgery could be curative, perhaps chemo or radiation can solve this. So please, if you or a loved one have ever felt stuck, have ever felt like you're in that survival mode, lack of control plus threats. We talk about this all the time on my channel here, but we don't talk about it as much as we should, especially when cancer is at risk, when heart disease or other conditions are at risk, where we ignore the warning signs because we're afraid. It's easier to isolate in our comfort zone than to threat the risks of maybe being diagnosed with cancer. It's why, like at the very beginning, we said this phenomena called the maladaptive denial of illness. It's a coping mechanism to isolate ourselves. Whether we're isolating ourselves from our social circle or our friends or our doctors, it's the same underlying phenomena. We don't want to address things that are uncomfortable when we are in survival mode. So please, please share what you're learning with others and advocate for yourself. Our broken healthcare system does not give us enough resources to fight these little bacteria, sorry, this side, like H. pylori. So preventable, so easy to treat with antibiotics. Yeah, it's a 2-week course. It sucks. It's lots of pills, but much better. Let's use Toby Keith's example to advocate for ourselves to prevent gastric cancer whenever possible. So I want to answer your questions now. Once again, if you learned something new, please hit that like button and share what you've learned with others. Cheryl has a question. Who should get an EGD? And ketamine has helped Cheryl become unstuck. Well, that's wonderful to hear. You know, I'm an advocate for ketamine as much as other ways of unstucking ourselves through meditation, through talk therapy. I am a big fan of CBT in the right patient. But regardless of how you got unstuck, I'm so happy to hear that. I mean, ketamine, that's fantastic. Who should get an EGD? Well, you need to talk to your doctor. But when someone presents with ongoing symptoms, especially of acid reflux, that needs to be addressed not only for gastric cancer, but more commonly for esophageal cancer and erosions. We want to make sure that we are addressing early on these pre-cancerous lesions. Darian, good to see you. I don't know if I'm ready yet, but hopefully I will be. Turtle, getting out of comfort zone, especially when in survival mode, is very true. Absolutely. It is necessary not just for our mental health, but for our physical health. And hey, Turtle Runner, that's why the mind and body are so deeply connected. D Random had H. pylori, and you know it's painful because those ulcers can, that's not from stress the way we thought. It's often from H. pylori in the vast majority of individuals. And it's more common in the East, in Eastern Asia, than in the West. Gastric cancer is a big deal in East Asia. Justin, does gastroparesis have a higher risk for stomach cancer? Not necessarily, but you do need to address why the gastroparesis is there, whether it's from diabetes or from medications. We had a whole, we talked about Ozempic and gastroparesis in a recent live. Very important to address it. Can ovarian cancer metastasize to GI cancer? Well, theoretically it can. And ovarian cancer similarly has this bloating, this early satiety, such vague symptoms that if you're not in a good mental health place, it's easy to blow off or be in denial about. Michelle says her husband had stomach cancer in his family. He gets yearly checks. I'm so happy. Michelle, does he get an EGD annually? Is that his screening? Zena, you are so welcome. And here, my husband, says Blue Dog, is having his esophagus burned every 8 weeks for 4 or 5 sessions due to Barrett's. So when you say burned, I'm not too sure, who's doing the burning, but Barrett's esophagus is one of the examples. If you have unrelenting acid reflux, it will burn your esophagus. And every time those cells die and regrow, it's a chance for cancerous mutations to kick in. Just like in the stomach, the esophagus is a very common site for this to happen and super preventable if we can address the underlying cause of the acid reflux. MMZ, how can we restructure our healthcare system to enable more effective preventive medicine? That's a great question. I can't answer that possibly in this one Q&A question, but it has to start from the very top, the very bottom. Our incentives are entirely upside down in the Western medicine world, and doctors are not given the tools to actually address the root cause of the patients and give them the dignity and compassion that they need to uncover their inner healing potential. Erythromycin, Justin, it sounds like you have your gastroparesis from diabetes. I'm so sorry. It is very challenging. I hope that you are an advocate for those. Most individuals don't even know what gastroparesis is, even though it can cause so many issues for our health, for our nutrition, etc. Use protonics sparingly. Ringo, protonics can be powerful to minimize the risk of Barrett's esophagus. Protonics is pantoprazole, one of the most commonly prescribed proton pump inhibitors. But Ringo's right. Proton pump inhibitors carry risks, perhaps malabsorption of certain vitamins. Always a concern for what happens to our stomach if we reduce the stomach acid from the proton pump inhibitors. Well, what is going to grow in our stomach without that acid that's normally there to keep certain bacteria from growing there? So there's a time and a place for them, but we should address the root causes. Many individuals have worsening acid reflux from diet or lifestyle, eating too late, for example, and then lying flat. Whatever the reason is, if we can find a root cause that does not involve protonics, of course, that's going to be more sustainable with fewer side effects. So I love what you said, Ringo. Toby Keith did have stomach cancer. That was his cause of death, 62 years old. There's a colonostomy, doctor, does having a colostomy and ileus mean then have a reverse? Oh my gosh, I don't understand, Billy Bob. Increase my risk for stomach cancer. So anytime you have cancer, there's a theoretical risk. Now, we're talking about the stomach specifically here. In the colon, I do not know the exact risks, the numbers of increasing your risk by having those types of procedures. But if I'm understanding correctly, and you had colon surgery, that's different than the stomach surgeries that we're talking about that can predispose to stomach cancer. Kathy, Heidi, a big thank you to Heidi always for helping out to help make this information more accessible to everyone. So thank you, Heidi, as well. I've been on omeprazole for almost 10 years, says Lucy Cat. Will getting tested for H. pylori help? Well, Lucy Cat, it's very reasonable to talk with your doctor about being tested for H. pylori as a cause. Absolutely. 10 years of omeprazole is a long time. Now, there's a time and a place, but you should talk with your doctor about other ways that we can come off of this medication safely. You can't have untreated acid reflux, but you also would want to avoid medications if possible. Heidi, thank you so much for that shout out, public announcement here. Colonoscopies in in an upcoming video I have about what are the greatest health risks in 2024. Cancers in young people are increasing, especially the preventable cancers, and colorectal cancer is absolutely one of them. So these colonoscopies can be so life-saving. Is interferon still prescribed? Yes, Julian, but less for hepatitis C since the advent of sulfosphamide. And gastroparesis again, it is no fun. Peppermint, ginger is the classic natural Reglan, and fennel oil. Well, Pamela, thank you for sharing what's worked for you. I hope others can discuss that with their doctors to try that, see if it's right for them. You look good as well, Haya. I had a colonoscopy on Friday, Lucy Cat. Well, I hope your colonoscopy did not show many polyps. And are there markers in blood work for this cancer? Good question, Mary. Not to my knowledge as of yet, but H. pylori testing is a good marker to see if there's a potential root cause for unrelenting gastric inflammation. Now, these other genetic tests I'm talking about can be obtained in other ways, but in terms of a blood marker that increases with gastric cancer is a different story. Kavita, I have ME/CFS and complex PTSD. I'm 65. And my worst, severe neuropathy. Why is there nothing to help? Well, Kavita, ME/CFS is a tough one. It's not so related to gastric cancer, except that, like we said, it's not. I would totally understand if you had any of these symptoms and you're in a place with maybe medical PTSD on top of that, it would be tough to talk to your doctor about it. Well, I can't answer your question about the severe neuropathy, but I'm certainly wishing you the best, and I hope that you feel empowered to speak with your doctor about your ME/CFS and your neuropathy. And for anyone else out there who is struggling with ME/CFS, you're not alone. And the more we can raise awareness of your condition, it's probably not as rare as we think it is, and doctors need to be more aware of it. I'm not aware of uprising in cancer in young mothers, but young men and women in general are having increased rates of cancer. I have a whole video upcoming on that in just a couple of days. Tasha, good question. Surgeries in the stomach area. Whenever you have surgery and you're cutting the stomach open, you are allowing for cellular damage and cellular regrowth. One mechanism by which we suspect this might increase the risk of cancer is that as these cells are regrowing, such as when they're inflamed, etc., Every time you make a new cell, you have a risk of causing a DNA mutation. Every DNA mutation can theoretically cause a cancerous mutation. So that is one of the reasons why. Can H. pylori cause gastric reflux? Well, if we have a lot of inflammation in the stomach, you certainly can cause an ulcer, and that can produce excess acid. So if we have someone with severe acid reflux, it's worth considering, is there an ulcer as well in there due to H. pylori or not is a different question, but there can certainly be an association. And let's have one last question. Sorry, I'm just laughing at your questions here. All right. Kathy says, I've had one colonoscopy. I'm almost 64. I have tremendous fatigue, overweight, and that doctor is making me take Linzess. There are days, sometimes 5 in a row, without a bowel movement. Gosh, I'm so sorry, Kathy. I wish I could better address what's going on, but not knowing anything else about you and over YouTube in particular, not much more I can say other than please don't stop advocating for yourself and talking with your doctor about how can you address the root causes. Obesity is from so many societal pressures, and mental health plays a huge role in addressing the root causes of why. Relationships with food, self-image. I mean, the list goes on and on. But being stuck, my heart goes out to you, Kathy. I hope everyone here is sending you some positive energy and healing energy, not in a woo-woo way, but to help empower you, to advocate for yourself and find ways to address the root cause. So I'm wishing you all the best. Thank you for your questions. Please hit that like button if you learned something new, but more importantly, share with others what you've learned so you can advocate for yourself and your loved ones in our broken healthcare system. Until next time, remember that you have more power over your health than you've probably ever been told. And we can certainly discuss more on our next private Zoom stream in the exclusive access group. The link is below. Hope to see you guys this weekend there. Peace.